I'm here today with Dr. Michelle Cretella, and she is the executive director of the American College of Pediatricians. And I'm so thankful for you to be here today because I'm connected to a lot of people who are concerned about what's happening with transgender ideology and the idea that kids can be transgender. And they have a lot of questions that really only a pediatrician can answer. And maybe you won't even be able to answer because some of these are experimental, as we know. But one of the concerns that people have is that children are being put on antidepressants, and they're wondering if there's a connection between antidepressants, antipsychotics, sort of that whole range of medications, and the increase in transgender kids.
Oh, I see. Okay. Um, I the short answer is that the question has not officially been studied. Um, as- what we do know is that, as with any medication, there are always side effects, and particularly with the most common class of antidepressant used with teenagers is the family that includes Prozac, or the serotonin reuptake inhibitors, SSRIs. Um, and while Prozac has a long track record in pediatrics, the FDA ultimately did place a black box warning on it and other antidepressants in that family, because for reasons we don't fully understand, it seems that young people under the age of 24, so particularly between the ages of 15 and 24, um, may have an increased risk of suicidal thinking and activity within the first 2 months of using those antidepressants. Um, One hypothesis was that um, the depressed children, teens, and young adults actually start to feel, they may start to feel just good enough to actually carry out the suicidal plans that they may have been too depressed to carry out in the past. I mean, it's, again, we don't know specifically why. So as pediatricians in training, I was taught, um, if you do prescribe this medication to a child, a teen, have very close follow-up, especially in the first 2 months. And we never prescribe the medication alone. Always make sure the child is in individual and family counseling as well. Um,
And that can be problematic because in some
mm,
states, therapists are required to affirm a gender identity and because of the new therapy bans. And so it could, I mean, it's hard to parse out sort of the cause and effect here. But if a kid is on an antidepressant and required to go to a therapist, and that therapist is only allowed to affirm a gender identity, it's hard to know if, if the kid coming in has that identity, or if maybe it develops as a result of them starting to feel better and connecting with peers. There are a lot of factors and variables here, so it'd be really hard to study.
right. So if you have a child or teen who's struggling with their with a gender identity that's incongruent with their sex, um, it would be really important. I know it's difficult, but it'd be really important to try to find counselors and therapists who would be willing to focus on healing the child's depression and anxiety first. And I mean, certainly whenever I cared for many, many adolescents with depression and suicidal thinking, and um, the most important thing is that bond and connection, that rapport, connecting with your patient, and a lack of judgment. And it is absolutely possible to connect with your patient without um, making them feel judged. right? I mean, there's a stigma attached to depression alone, just as there's a stigma attached to coming out LGBT. Um, and we don't have to affirm a child's non-traditional gender identity any more than we have to affirm their suicidal thinking or affirm their depression or affirm their anxiety. All we do as um, pediatricians, counselors, even parents, but what we really need to do for that child is to affirm them as a person with dignity and just someone who is loved and respected by us. Um,
That's
that,
so, I think that's so important. And something you said really jumped out at me, and I hadn't thought of this before. But you have gender clinicians such as John
mm,
Hossam Kennedy who say the reason that these kids are depressed is because of their gender incongruence. And then
mm,
there are people on the other side who are saying, we need to treat the depression and it's likely that incongruence will go away. And so there are these two very different sides. But it occurred to me that if you have a kid who is depressed and
mm,
they've gone to therapy and they've taken medication and that hasn't helped, if they hear someone say, well, you know what? If you transition, that will cure you,
mm,
and then not only do they get that message, but then they get affirmation from all these different activists and organizations. It wouldn't be surprising to me that at least initially that their depression would lift while they were being, encouraged and affirmed and getting all this attention and affection. And so I think that that's where it's so difficult in this debate because the other
mm,
side sort of has this completely opposite view as to how to treat it. And what you and I and others are saying is let's cure the depression, let's cure the anxiety, and then let's see where the child is.
and affirm the person,
Right.
affirm the person in, I mean,
In the same way that you would
there's,
in the
oh,
same way that you would in the same way that you would affirm, someone who had a drug addiction or an alcohol
right,
addiction. You
yes,
wouldn't
yes.
approve of the addiction, but you also wouldn't judge the
You
person.
wouldn't judge them. No, you don't, as a clinician, or if you're a parent or a teacher, anyone in the helping profession, it's not about condemnation. It's about we affirm that, hey, you you've got dignity. You deserve to be well. You do deserve happiness. You do deserve. Um, yeah, it's just that basic connection, that basic recognition, that basic truth that, yeah, you are a person and you are worthy of healing. And I'm going to walk with you. You know,
And
I'm going to
so
help you as best I can. I'm going to help you.
and
Mm,
so often now we just tend to run to the doctor for medications rather than for that kind of healing, really healing. And I guess that kind of comes to another question that people have had, in that a lot of these psychotropic medications actually tamp down the normal sex drive that develops in puberty. And as a result of that, there are questions as to, what is the interaction between, if you've got a child who's, and I hear of these kids and they're on many different medications. So they're on, perhaps something for ADHD, depression, anxiety. And then they want to pile hormones on top of that. And since you said that they haven't even studied the medications on their own, they most likely haven't studied the interaction between the medications and hormones.
right. To my knowledge, they have not studied the interaction of antidepressants and antipsychotics with, let's say, puberty blockers and cross-sex hormones. That has not been done. But there absolutely are interactions because, I mean, natural puberty, the natural sex hormones are um, critical in terms of organization of brain development during puberty. Uh, so yeah, it's a very messy recipe, and it's a very dangerous experiment. Absolutely, a very dangerous experiment. I would say in general, pediatricians, and I think even my psychiatric colleagues, we're not, you don't, they're not pill pushers in general when you're looking at psychiatric care of children and teenagers. That's not the first thing that we do, because we recognize that every drug, every medication has side effects. So you don't rush to write a prescription, but there is a place. There definitely is a place for psychiatric medications in pediatrics. It's just maybe not the first tier, nor um, do we, nor does any reputable child psychiatrist or pediatrician say that, oh, pills alone are the answer. These things, it often takes individual as well as family counseling in addition to medications to help. And that's with something as common as depression and anxiety. So throw gender incongruence into the mix, and yeah, it's quite challenging. Mm.
So you mentioned puberty blockers, and that's one of the medications that are being given to really young kids, often as young as 8 years old. And one of the things that we hear regularly from advocates of using puberty blockers for gender confused kids is that they're fully reversible. And I've looked at the side effects, and to me, they do not seem fully reversible. I was wondering if you could just address that.
Yeah, it's interesting when because while it's true that if you stop the puberty blocker, eventually the child's pituitary gland in the brain will start to reactivate. But just because it can reactivate, sometimes it may even take as long as a year to a year and a half. That does not mean that potential damage is reversible.
We had a little bit of technical difficulties, so we're back for part two. Michelle, thank you for joining me again.
Hey, glad to be back.
And we were talking about puberty blockers. And one of the things that I hear over and over again from people who support the use of puberty blockers is that they're fully reversible, which is hard for me to understand, because if you pause something, you're pausing development, then I don't know how you can go back in time and grab that developmental time that you lost. But can you go into it a little bit further?
Exactly. No, you're right. So the key here is that puberty blockers, they've been described as fully reversible in the context of treating disease, in the context of treating precocious or early puberty. Safety is always relative. And when you're dealing with a disease, that precocious puberty, has harms of its own. Every drug, including Lupron, which is the #1 puberty blocker used in America, has side effects, has some risk of harm. But when Lupron is used for precocious puberty, the good that it does outweighs the risk. Okay. And therefore, it is better to pause early puberty and then take the puberty blocker away and let the child go through normally timed puberty.
And we're talking about kids
But
who
we're not
are,
talking about that.
right,
We're
right.
talking about children who are physically healthy, and they are about to go through normally timed puberty. Now, that's not disease. That is a critical developmental period, psychosocially and physically and sexually. When you put a child on Lupron, you're preventing them from secreting their normal sex hormones. And sex hormones, it's not just about appearance. For example, Testosterone in boys will make them promote hair growth, broaden the shoulders, deepen the voice, more musculature, helps them mature their bones, and of course their sperm production, maturation, and production. But testosterone in boys is also critical for wiring of the brain. And similarly in girls, their surge in estrogen is what's important, not just for their secondary sex characteristics, their physical appearances that get them ready to appear more like a growing woman, but also for the young girls, or organization of the brain. That we
Right.
know this has been documented scientifically.
So the puberty blockers
And you
don't just
can't,
prevent the secondary sex characteristics, they actually prevent development in all ways.
you're freezing not only their sexual development, but their psychosocial and physical development at every almost every organ system that has receptors for sex hormones is going to be frozen. And this is most critical when we think about the brain. Um, and as an example, while there are no long-term studies in children on the Lupron for gender dysphoria, uh, we do know that in men and women who are treated with Lupron, men may be treated for testicular cancer with Lupron, and women are often treated for endometriosis with Lupron. They experience memory loss and other cognitive impacts. And that's why we are deeply concerned about what we could be doing to these young people's minds,
Wow.
with their brain.
That's really
Um,
scary.
so just because a drug can be turned off, so to speak, doesn't mean that, as you pointed out, we can't go back in time and give them those months and years of normal development back. And it also doesn't mean that the damage is reversible.
Right.
I think earlier in our previous segment, I started to explain, if you read the package insert of Lupron, right on the package insert, it says, this drug can cause emotional instability, emotional lability, and it tells prescribers to monitor for the onset of new psychiatric symptoms or the worsening of symptoms. And in fact, we know in the UK, Dr. Michael Biggs out of Oxford, he discovered that the UK's Tavistock Gender Clinic had suppressed evidence that girls who went on puberty blockers experienced worse emotional results than the girls who were not taking the puberty blockers. And in particular, he noted they had more body dissatisfaction, and more distress. So that is what we would expect to see, given what we already know from the package insert.
Well, and that makes sense to me because, I've heard Jeff Younger and other people talk about puberty being the cure for gender dysphoria. Because when you go through puberty, so many of these kids, their gender dysphoria either lessens or goes away. And so by putting them on puberty blockers, you're actually not allowing that natural process of healing to happen. And the other thing that I'm thinking of is that if you have a kid who's on puberty blockers, their peers are all going through puberty and they're not. And so a kid who's already feeling different and maybe not fitting in very well is going to be even more distant from their peers as their peers go through puberty and they don't.
Right. And in fact, we know that is exactly what was observed by advocates for puberty blockers. And so, for example, Dr. Joanna Olson Kennedy, that is why she started advocating the use of cross-sex hormones simultaneously with blockers or skipping the blockers altogether. So now what you're doing, the puberty blockers alone will freeze sexual development, which means the children will not produce mature ovaries or mature or if they're boys, they won't have fully matured testes. But if in addition to the puberty blocker, you now introduce the cross-sex hormones, that infertility will become permanent sterility,
And the changes,
which,
I mean, it's unbelievable to me. Joanna Olson Kennedy, I read, she is now giving cross-sex hormones to children as young as 8 years old, which to me is astounding. I mean, these are kids who are barely starting puberty and they're getting cross-sex hormones. These are children who still believe in the tooth fairy. I mean,
right.
these are really young kids, and to give them cross-sex hormones and basically making these changes permanent, sterilizing them and causing, we don't really know what's going to happen, because I don't think that there's ever been a generation, we've never had kids who have gone through this protocol before. So we really don't know what the results are going to be, but we do know it's not a normal developmental path.
It's not a normal developmental path. And we, we know we're stopping, we're arresting the normal developmental path. And we do know that testosterone and estrogen, they are both the synthetic forms that you give. They are toxic. We know the toxicities they have. So we can predict that there will be significant harm. There is no evidence that to say, no long-term evidence to say whatsoever that this is safe and going to lead to good outcomes. We are giving these children, for all intents and purposes, this is chemical drag. You know, we start out, our culture is now indoctrinating children from the youngest ages with the lie that anyone could be born in the wrong body. Nothing could be so preposterous. And then when they develop this confusion, parents are being told to cross-dress them, and everyone's being told to play along. And then when they get to the point where biology would confront them with the reality of the beauty of their own bodies, well, now we're giving them chemical drag, where
And to me, this is
it's
one of the reasons that I'm so passionate about stopping this, because
mm,
I have no doubt that, given my trans identity as a child, if I were alive today, I would have been put on that path. And for me, having children has been amazing. And when I think about
mhm,
what the world would be like if I hadn't been able to have my kids, I can't even imagine it. And I know not everybody's going to want kids, but when I was even in high school, I was absolutely sure I did not want kids. I had
right.
no doubt. I didn't like kids. I didn't want anything to do with kids.
Hmm.
I would have happily had my tubes tied. If somebody said this treatment is going to sterilize you, I would have said, that's great. No problem.
Sure. Yeah.
And I had no
Most people
idea.
are not the same today as they were when they were teenagers,
Yeah, and I
let
honestly, when
alone
I think about
preteens.
it, I was so adamant that I didn't want kids. I didn't like kids. I didn't want them. And now I
Wow.
have three amazing kids that, and to me, thinking about that I could have been sterilized if I had been born a generation later.
Right.
It breaks my heart, not to mention all the other horrible side effects that happen to the body. These
Yes,
women who are on
we do have
testosterone.
very good record now that with cross-sex hormones, there's 5 times greater risk of heart attacks and strokes, for example. Rates of your risk for developing certain cancers increases, high blood pressure, sleep apnea, prediabetes. These are all things that are predictable just in terms of how the testosterone, the high levels of um, testosterone impact women, and how high levels of estrogen would impact men.
Is there any other case in medicine that you can think of where you treat a healthy person with something that's going to cause disease?
Right. No, there you go. No, there's no other there's no other case in medicine in which you give a physically healthy person a dangerous or disease inducing medication. And that is a good point that you raised that I didn't say explicitly, is when you are giving a physically healthy child Lupron or any other puberty blocker, you're inducing disease. You're giving them the disease. There is such a thing as the absence of puberty, hypogonadotropic hypogonadism. I mean, a mouthful, but that's the disease, not normal puberty. We should not be giving a medication that literally induces a physical disease. Um, Particularly when you're dealing with children prior to puberty who have distress. If you have children prior to puberty who are distressed about their biological sex, as you pointed out, the vast majority are going to resolve either before or after natural puberty, before adulthood. The vast majority will resolve by late adolescence.
And I've heard studies up to 98%. I mean, a very high majority of them are going to end up.
Especially if, right, well, from what we know, I mean, particularly if you were dealing with a very young boy in this situation, with young boys pre-puberty, according to the Diagnostic Statistical Manual, 5th edition, as many as 98% of those very young boys will resolve by young adulthood. And for girls, as many as 88% will resolve by young adulthood. So the natural course prior to all of this trans ideology, prior to this indoctrination, the natural course was very hopeful. But now with so much indoctrination everywhere from Hollywood, to preschools, your public libraries, and all over the internet, it's very difficult. And I would encourage every physician or parent who encounters a case like this not to downplay it, but to basically work with the child and the teen to help them feel affirmed as a person, affirmed and respected as a person, and try to guide them to loving their bodies, just loving who they are. Help them,
Right.
especially when it comes to teen girls these days, help them see that there's more than one way to be a girl. You don't have to, there's so much emphasis within trans ideology, so much emphasis on sex stereotypes, and those are toxic. The meds are more toxic, the meds that they would be put on to so-called transition. But we really have to help our children reject toxic stereotypes and
Well,
just to
and the other thing
become
is that when you're affirming this, what people don't realize is you're actually affirming a child's self-hate. You're
right.
actually affirming the fact that they hate themselves as they
Mhm.
are. And really that's not something parents or teachers or doctors or any authority
Right.
figure
No.
should not do. That they should affirm the child as a beautiful person, as someone who's struggling, who has some issues. But to affirm self-hate, to me it would be like a child who's cutting,
Yeah.
and to say, oh, well, you're a cutter and you were probably born that way and there's nothing we can do about it. So just go ahead and cut. And there's probably going to be lots of negative outcomes to that. But we're going to affirm that cutting because we don't want to hurt your feelings and tell you that cutting is dangerous or harmful. And we don't do that. I mean, that would be
With
absurd.
any, right, with any other psychological condition. And I there's so much overlap, particularly in the teen girls, with transgender belief and anorexia, bulimia. Um, uh, in my opinion, I I believe many of the same factors that predispose the eating disorders predispose the transgender belief. I think a lot of these girls, and I think even the young men involved, they're searching for answers and relief to real pain. Um, but latching onto that transgender belief, it could be a maladaptive response. It's their subconscious attempt to find healing. You certainly find a welcoming community when you latch onto that identity, when you claim that identity. So I think for those of us who really want best outcomes for them, the best physical and psychological outcomes for them, we need to affirm them in the reality of their whole person. Uh,
And I really think it's important what you said, that these children, these kids they are hurting. Like there is a
mm,
wound there.
we,
There's
right. We
something,
can't minimize. We don't
right.
want
And
to minimize
I
that at
feel a
all.
lot of people are very kind of, cavalier on it. People who don't agree with it, who say things like, well, there is no such thing as transgender, or, these
Mm,
kids, and I think what they're not recognizing is, for whatever reason, these children are hurting. There's something, and I think part of it is that we've raised a generation of very fragile kids who aren't
mm,
very good at handling difficulties, and we haven't provided them with lots of skills to navigate these things. A lot of times we medicate them rather than teaching them skills. And we have also this bullying culture, which despite, like, it seems like despite all the efforts to
mm,
minimize bullying, it seems like bullying is even more profound now than it was when I was a kid.
mm,
And so I feel like we have this generation of kids that they really do need support, but they also need very clear boundaries, and they need parents who are going to parent them rather than just try to be their friend and affirm them in whatever it is
mm.
that they want to do.
Right, right. Yeah.
One of the things that you mentioned earlier was about Johanna Olsen Kennedy putting kids on cross-sex hormones early so that they could go through puberty with their peers, is what she says. And that's something that I hadn't thought of before. But the other thing that I wondered about is Lupron is incredibly expensive. These puberty blockers are outrageously expensive. And I wonder how much of pushing kids to go on cross-sex hormones earlier and earlier is also economic, that testosterone is a whole lot cheaper than Lupron. I don't know if you have any thoughts about that, but it's something that I wondered about.
Um, I don't know for certain if, I mean, that it could be one factor. I do know that the activists have been working very hard for many years now to get all of the major insurance carriers to cover both blockers and the cross-sex hormones. Um, so I think that's where the focus is.
And
I think the move toward younger cross-sex hormone use was prompted by their late recognition that giving puberty blockers caused that iatrogenic, it was harm in that it isolated them from their own peers, and it's an obvious self-fulfilling prophecy, because if you have a little boy who goes on puberty blockers, is frozen in that prepubertal state, you've got a prepubertal boy who's pretending to be a girl, who now is definitely not, he's going to not be able to relate at all to maturing boys, and he's even going to be awkward as compared to the normally maturing girls. So just a mess. And I think without it was sort of this under the radar concession that, ooh, this, we're messing up here, so
mess up even
let's
more.
let's mess up even more. Yeah, let's add something even more toxic, and this way they can go through the puberty they want.
Well, and that's what's so disturbing to me, is that the other thing that I've heard her say is that we don't want kids to have to go through two puberties, because if you go through your normal puberty and then you decide you want to transition, then you have to go through this other puberty. So instead, they're going to induce menopause in girls.
Right,
I mean,
right.
I, the whole justification of it I find very disturbing, and I'm just wondering, as a doctor, how do you respond to this? Because as a layperson, I'm watching this and I'm thinking, have people just gone crazy? How is this happening? How is it that we have medical doctors who are advocating this? How do you respond to that?
Yeah, this is because science doesn't tell you what you should do. Science only tells us what we can do. All right, medicine is a moral endeavor, because in medicine, doctors advise. We give patients facts and then we tell them, well, here's what you should do. Um, and this is why the field is so messed up, is because we've been infected with moral relativism just as much as the greater culture. Um, yeah, it's the tyranny of moral relativism. If you can't stand up and say it is wrong to go against healthy natural design, then anything, whoever's in power gets to determine what normal is and gets to determine what healthy is. There's nothing, you will not have your true north.
Well, and
Well,
especially when
it's
you have doctors who are saying, well, the kid comes in and tells me what they want. I mean,
right, right.
I just find that so, and I feel really bad for these kids because
Mm,
they're getting the impression that they get to have this kind of control. And I worry, like,
mm,
what happens when they get out there in the real world and they realize they haven't learned these skills as to how to navigate difficult situations because they've been affirmed. They've been able to walk into a doctor's office and tell them what they want. They've been able to tell teachers what name to call them. They've been able to
mm.
walk into whatever bathroom they want. I mean, these are all kids need to learn these boundaries, and these kids are not learning. They're learning the opposite.
We need to function at a minimum, we need to all function within physical reality. I mean, I think it was Christopher Hitchens. I can't remember which one of his books I read. And the line that struck me was, I am my brain. I don't have a brain. I am my brain. And he'd be here, and if he were still here, he'd be saying, I am my body. Well, you know what? Atheist, Christian, Buddhist, we should all be able, if we should all be able to agree that our bodies matter. We are our bodies. You can believe that we're something more than that, but at a minimum, we are the physical reality. I mean, holy cow! If we can't agree on that, how do you
Yeah,
make any
and the language
decisions?
gets so convoluted when we start talking about people who produce sperm or
Right?
bearers
Oh,
of cervix.
please.
It's just really, I find it just um,
It's a dark
beyond
age.
convoluted. Yeah.
We're going into a dark age. Sex is binary. It is a binary, biologically determined variable, and period. The end. You are at your sex is your primary sex. Your sex is determined at fertilization, and nothing can change it. Nothing does, and that is a reality that is critical throughout every medical specialty and subspecialty.
Well, and
And
it
it's
affects
just,
how
it's
you provide
absolutely
care.
insane.
I mean, you provide different care to males and females
Right.
based on their
Mhm.
biology because they are biologically different. And so when people deny that, they're going to compromise people's medical care because doctors aren't going to know, how to treat this person because they're not being honest about what their biology is.
Right. Right.
And it's
This is,
interesting because I was talking to my daughter this morning about, what to believe at this point. Because if we have people who are willing to deny something as basic as biology, this is sort of like one of those fundamental truths.
hmm
If you have people who are denying that, then what do you believe? And if we have kids who are taught at, preschool age that uh,
some
physical
girls,
reality
right, right.
isn't
Oh,
isn't
some girls
true.
have penises.
Yeah,
No,
I
they
mean,
don't.
I can't imagine how scary that would be.
Yeah,
I mean, there's nothing that I mean, so it'll be
right.
really a horrible sociological experiment, and I worry so much about these kids, and hopefully we'll stop it before too much damage is done, but I feel like there's already been just a tremendous amount of damage done to these kids.
A tremendous amount of pain.
Yeah.
hmm
Is there anything else you'd like to talk about?
I will just throw out, I think it's important for viewers to realize that this is not merely a right versus left issue. Um, and I don't know if you've mentioned this group in other podcasts, but Society for Evidence-Based Gender Medicine um, is a group of physicians and therapists who are they're working together to keep politics out and to really look objectively at the science. So Society for Evidence-Based Gender Medicine is a good resource, particularly if you are working with or trying to explain the issue to um, family, friends, or colleagues. You can send them to that website.
Oh, that's a great resource. Thanks.
And of course, I mean, I also want to send your viewers to the American College of Pediatricians, but
And the Compassion Coalition.
and the Compassion Coalition. Yes, yes. I mean,
Yeah, and that's
obviously,
one thing that
but
It's giving me
the reason I mentioned Society for Evidence-Based Gender Medicine is they are exclusively that issue, whereas American College of Pediatricians, we promote what's best for children. We also deal with pro-life, the marijuana
contraception.
issue, and sex education, and a whole bunch of other things. Um, but,
Right.
but
And that's
definitely visit us at bestforchildren.org. And yeah.
and thank you so much for your efforts. I imagine that you probably do get some pushback from people. And most of us who are speaking out about this issue are targeted at times by bullies who don't want us to be speaking the truth. So I appreciate your organization and all the efforts that you're doing to educate people.
Well, thank you. Thank you very much. And I appreciate what you're doing. These are really difficult times to be parenting. And so it's important. It's important to uh, get this side of the story out.